Malaria control today, we've got some real challenges ahead of us. We've got 18 countries now in Africa, which hold 80% of all the malaria deaths globally every year. And within that, we can pin that down even further to just a few. Each one of those are countries that have enormous operational challenges. And that's partly why today they hold so much malaria death. Their countries torn apart by war, conflict, political strife. Their countries characterised by large-scale population displacement, from northern Nigeria through to Yemen, South Sudan, Central African Republic, Somalia, northeast Kenya. Places where people don't like to go unless you happen to live there. And if you do, you need help, and help that's designed to fit your setting. That doesn't mean business as usual. That means taking an approach which is novel, fits the situation, and where we're prepared to invest and apply tools that are purpose-built and designed to meet the needs of people who are displaced, people who are in the worst possible settings, where they don't have access to case management, that's diagnosis and treatment, and where putting them under a shelter that's treated, or a blanket that's treated, or spraying their housing, spraying their camp shelters, makes all the difference, may save their lives. Where larviciding the water that they depend on for their own supplies, for washing, for drinking, but where it also harbours mosquitoes that transmit disease. Combining those tools together in such a way that you can protect people better and give them access to treatment and diagnosis can be the life changer. There's no other way. If you don't do it, malaria rages without any curbing, and people die. If you're as young as a child, your prospects of surviving a malaria bout in any of these settings is very, very poor. You could die in 8 hours of having your first fever. So being slow is not an option either in the response. We have to be fast, we have to invest the right amount of money to have the right tools on the ground, and we have to deliver them in a way that's effective. How do we do that? Well, that means working with people who know what they're doing in conflict situations, who can truly reach people who are otherwise considered unreachable. There are a lot of good initiatives going on. The Mentor Initiative. It has teams that work in some of the hardest places on earth, alongside MSF, UNICEF, and other teams that come in to help with healthcare. Perhaps uniquely, its capacity to deliver very large-scale, very tailor-made prevention programs alongside delivery of case management at community level to reach those who just simply cannot access static health facilities is vital if we want to reduce death rates in these settings. And today we have brilliant combined programs going on with good partnerships with UNICEF in South Sudan and in Kenya and in other countries like Central African Republic, where alone we might be weak, but together we're much stronger.